Hello everyone, welcome back to my channel. This is Ronak Chandak and today we are going to learn how to take blood pressure. So blood pressure is basically the lateral pressure which the blood applies on the arteries, and we measure it using a sphygmomanometer and a stethoscope. So there are two types of blood pressure. One is the systolic blood pressure and the second is diastolic blood pressure. So systolic blood pressure is the amount of pressure when the heart contracts, and the diastolic blood pressure is when the heart is in relaxed position. Okay. Next, there are two methods of taking blood pressure. So the first one is the palpatory method and the second one is the auscultatory method. So the first one is palpatory method. Using this, you can only find the systolic blood pressure and not the diastolic blood pressure. So it is used before taking the blood pressure using the auscultatory method. So you will apply the cuff. So make sure that the tube is on the anterior aspect so that the brachial artery gets constricted. And don't tie the cuff very tightly. There should be around 2 finger space in between the cuff. Then next, tighten the gauge. So then start inflating the cuff and palpate at the radial artery which is on the lateral side above the wrist joint. Okay. So inflate it to the point where you cannot feel the pulse anymore. Now slowly release till you can start feeling the pulse again. So the blood pressure, the systolic blood pressure recorded for him is 124 mm of Hg. So next is the auscultatory method. In this you will auscultate at the brachial artery which is above the elbow crease in the medial side. Okay, and then you will inflate the cuff till the blood flow is restricted. So here I have auscultated the brachial artery. Now I am inflating the cuff till I cannot listen the okay. Now I will slowly release it to the point where I will find the beat again. So here my finding was 126 mm of Hg by 76 mm of Hg. So this is how you will calculate the systolic as well as the diastolic pressure. How? First you will inflate the cuff to the point where you cannot feel the beat again. Then slowly deflate it to the point when you can find the beat again. That will be your systolic blood pressure. Then slowly lower the inflation and to the point where you cannot hear the beat again is what your diastolic blood pressure is. So here the finding was 126 mm of Hg by 76 mm of Hg. So this is how you record your blood pressure. So the next time you go to your postings, remember how it is done correctly. And there is a normal range for blood pressure. There is hypotension, which is reduced blood pressure. There is hypertension, which has two stages, that is stage 1 and stage 2. Do let me know in the comment section what are the recent guidelines about the ranges of the normal and abnormal blood pressures.